A $2 trillion federal relief package passed last week is meant to help those hit hard by COVID-19. It's the third such step taken in recent weeks, and when I spoke with Congressman Jim McGovern of Massachusetts' 2nd Congressional District, he said it's not likely to be the last. We spoke first about his thoughts on the response thus far.
I think we have to have a nationwide total response, and that means all states should be complying with what our scientists and our healthcare professionals have suggested. It doesn't make any sense to have Massachusetts abide by one set of standards and Tennessee by a whole different set of standards. We don't have walls that separate our states. We're one country. So if you really want to deal with this effectively, we're all in this together.
And to your point, in the CARE Act, one provision of that is aimed at healthcare workers who clearly are working to keep many of us here safe. And that includes $200 billion for hospitals, healthcare workers, and healthcare research. And included in that is I imagine, some strides to address what you've been talking about, where FEMA is outbidding the states. I know Senator Warren had looked into this earlier this week. Is there any clarity around whether there is a way to stop this?
Yeah, well, the way to stop it is for the federal government to stop outbidding states and to make sure that states have the access to all the necessary equipment that they need. Look, let's be frank here. The White House response started too late. We should have started this a lot earlier, and the coordination should have started a lot earlier. But here we are now. You can't change the past. You can only help shape the future. And again, there is no excuse for any governor not to be able to get the necessary equipment they need to save the lives of people in their states, whether that be face masks, whether that be hospital gowns, whether that be ventilators. We need to make sure that we produce enough, and that the governors and all over the country get what they need. This is about saving lives.
To your point about producing enough, I know that the CARE Act, as I just highlighted, has that money in there for some of these protective items. But are you confident that manufacturers are going to be able to fill orders if the money's there?
Again, many of us a long time ago urged the president to invoke the Defense Production Act, basically to produce the necessary equipment. We have a shortage of ventilators. During World War II, we had all of our factories making airplane parts because we wanted to do everything we could to be prepared to win World War II. And so again, the president just recently invoked the Defense Production Act. So we're behind. But again, we have some catching up to do. And the ventilators are incredibly important, as is the testing. As is the personal protective equipment.
Looking again to the CARE Act, this includes some drastic changes to unemployment and the way people apply and even who's eligible. And as I understand it, the way the act was written is that there's now an additional 13 weeks of federally funded benefits
Correct.
Available to people. Who is that available to?
So it's available to people who are out of work. It's available to let me put it this way. If people have any questions, they should check our webpage. My webpage is mcgovern.house.gov, and we will and it's all explained there about who qualifies for what and how you go about applying for it. And again, my office, I know Congressman Neal and the other members of the delegation, as well as Senator Markey and Warren. Our offices stand willing to work with people to help them cut through all the detail here and make sure they get what they need.
Because there certainly is a lot of detail, 880 or so pages of this CARE Act. So I know people do have a lot of questions. I appreciate you sharing that resource. I know one question we had received was because there are a number of artists here in Western Massachusetts, as you're aware, in Berkshire County in particular. People who are self-employed are not typically eligible for unemployment. Did this address that?
In many cases, it does. And so my hope is, again, those people will get a benefit as well. And again, if there's any question, people should reach out to us and we can clarify, what the details are. Again, everybody's in different circumstances, but we try to accommodate, the vast array of our population and meet their needs and get them what they need. So hopefully this will help. Look, this is our third package. We're going to have to do a fourth package, and we might have to do a fifth package. And so if there are holes in this package for whatever reason, if some issues aren't being addressed, Congress needs to come back and we need to address them immediately.
Any issues you're aware of right now that you think will be folded into the fourth or fifth package that you mentioned, or is that just something you're leaving on the table for future
Well,
discussion?
no, I mean, one thing that unfortunately we received some resistance from the administration on is increasing SNAP benefits for people who are on SNAP. In the best of times, we have unfortunately a problem in this country where close to 40 million people don't know where the next meal is going to come from. Because of this virus, a lot of the places where people go to get additional food, have been restricted because we can't gather together. So we need to make sure people have enough to be able to buy their groceries in the supermarket or wherever it is safe for them to be able to purchase them. And that requires an increase in SNAP benefits. By the way, the average SNAP benefit is only about $1.40 per person per meal. And so we have to make sure that we also worry about the most vulnerable in our society during these difficult times. And so I would like to see an increase in that. We need to provide monies for the states to be able to allow people to vote by mail. Again, we have elections coming up. There's still primaries going on, and then we're going to have an election in November. What we're told by Dr. Fauci is that even if we can bend the curve, the disease doesn't go away. And so, people should be given the option to be able to vote by mail from their homes and not have to necessarily go to polling places. That will require additional money. There'll be more needs for our small businesses and for our manufacturers, and our hospitals and our community health centers are going to need additional support as well. And so that will have to be in the next, additional monies for them will have to be in the next package as well.
You mentioned small business. In the current package that was passed a week ago, it does include money for small businesses, and some of it is forgivable. A good portion of it is forgivable if it's spent on, say, paying for your employees, a few other specific areas. Was that heeding what happened in 2008? We heard so much feedback from small business that there wasn't a ton of support for them during that financial crisis.
We've learned some lessons from that package back in 2008. And again, one of the lessons I think we learned, and I want to credit House Democrats for this, is that we took what the Senate had originally proposed here, which was a bill that seemed to be heavy on support for corporations and no strings attached. And we turned it around to make it a bill that is more responsible for the people of this country, the workers. What we want to make sure is that small businesses, which are the backbone of our economy, can remain viable during this crisis, so they can open up again when it is safe to do so. And we also want to make sure that big corporations don't take the money that taxpayers provide them, like they did last time, and use it for stock buybacks or to enhance the salaries of their CEOs. Again, we need to focus in on the majority in this country, the regular people in this country, the working people in this country, and that's what this bill does.
I read a report this week that was urging small businesses to apply for the assistance as quickly as they could because the money might be doled out in the order that applications are received. Do you know that is that correct?
Well, I think it is in everybody's interest to apply as soon as they possibly can. And again, we may have to come back and we may have to add to that pot of money. Look, this is a crisis unlike anything we've seen. Our entire economy is basically on hold. And so while we have to be focused on saving and protecting lives, and again, not only the CARES Act, but the other bills that we passed do that, we also have to make sure that, we have an economy to revive when this is all over with. And so, that is what we're trying to do here. And again, we have no idea how long this is going to go on. And I would urge everybody to heed the advice of the medical experts and the scientists. Stay in, follow all the rules. But as you do that, we want to make sure that if you're a small business person, that if you're just a regular worker, that you have something to go back to once this is all over with.
Congressman, a minute ago you mentioned elections, and this care package does include money for states to apply for grants that would look ahead to the 2020 election. Is the idea behind that states will come up with a plan for how to distance vote, or what is the idea behind the grant process there?
Well, I mean, it is basically to help, to provide for security in our elections and to figure out how we should proceed in terms of making it safe for people to vote. But the bottom line is the CARES Act is woefully inadequate in terms of money to help states actually implement any plan. Again, we ought to be able to vote by mail. That is the safest thing to do, and people ought to have that option. And again, the president on one of the networks said, "Well, if everybody gets to vote, there won't be any Republican Party." Well, that's kind of a stupid excuse, to try to not support our democracy. People, the right to vote is a sacred right, and we need to protect it. And we have an election coming up in November, and we know that that this virus will not be totally eradicated by November. Again, even if we bend the curve, it will still be around, and people are going to, need to take certain precautions. And I think one of them is to stay away from big crowds. And so let's make this election easy for everybody to be able to participate in.
To your point about big crowds, I know something that you've been looking into as the chairman of the Rules Committee is the possibility of Congress voting remotely and from the distance. What have you learned?
Well, I mean, the problem is that, yeah, we have great technology, but the technology is not necessarily secure. And if Congress is going to have a debate and we're going to have remote voting, we need to make sure that people can't interfere with connections and being able to do that. The other thing I've learned is that members of Congress, are at various points in terms of being technologically literate. And we've got a bunch of members of Congress who still use flip phones. And so, being able to have a conversation like we're having right now is something that they are not comfortable with doing. We also have some members of Congress who live in areas, quite frankly, that aren't connected to the internet. And again, that points to the fact that we need to invest more in our infrastructure. So, I've made some suggestions of how to vote, maybe by proxy. If some people can come to Washington, those who can't make it can give their proxy to those who are here to tell them how they would vote. But we need to figure this out, and we also need to make sure that we start figuring it out quickly, because we need our committees to work. Congress needs to do oversight on this CARES package, $2 trillion plus. We need to make sure that the money is being spent properly, that it's not going to help friends of the president or not going to enrich companies that members of his administration have particular financial interests in. We need to make sure that this is going to the people of this country, that it's being spent to support small businesses, that it is being implemented the way Congress intended it to. So we need to have hearings. We need to be able to figure that out. And my hope is in the next few days, we will come up with some recommendations so that Congress can operate more like it normally does when we're all together.
Congressman, in recent days, we've seen soldiers' homes have an uptick in COVID-19 outbreaks and other group homes as well. I've also been speaking with prison reform advocates who say that they're concerned that prisons, and they've been raising this alarm for a couple of weeks now, that prisons could be rife for COVID-19 outbreaks and have asked that low-level offenders be released from those settings. What's your position on that?
I think that makes sense, quite frankly. Again, this is a very dangerous moment that we're in, and the COVID-19 has proven to be deadly for a lot of people who have been infected. I mean, we're told that maybe 200,000 plus people may lose their lives, and that's if we follow all the safety precautions. And so it seems to me that low-level offenders, we can work out some sort of alternative way for them to be able to serve their sentences. Again, let me just say about the soldiers' home. I mean, that's a terrible tragedy, and we need to find out. We need to get to the bottom of what happened there. I mean, that is, these are our veterans. These are people who served our country, and it is really heartbreaking and sad to hear of what has happened to so many people who were there.